Hello, my name is Dr. Bob DeMaria, and I've been practicing since 1978. What I want to talk to you about today is how simple it is to do an ear adjustment. Now, not to be silly, you don't want to do this at home. We don't want any children doing this. This is very serious because you could really injure someone's ear. What I am holding in my hand right now is an otoscope. An otoscope is a device that we use to look inside of a person's ears. And what I would do with this fine gentleman right here, before I would do an ear adjustment, is I would look inside of his ear canal. You want to make sure that it's not red or inflamed, or if there's any fluid or exudate that's being released from his ear canal. If his canal is red, you might want to talk to his prescribing medical doctor, or you may yourself want to prescribe some kind of natural alternative. It's very serious, and I don't want you to have an infection that you may have missed. The tympanic membrane should usually be a very bright shining. So we would look at his ear. So what I'm going to show you right now is just how I personally would set up for an ear adjustment. The most important thing is you want to grab a hold of this earlobe like I did right here and get a firm grip, not too tight of a grip, but a firm grip. And I always have them slightly tilt their head to the opposite direction, and I make my contact like this, and I'm taking the traction out. So I'm going to have him side bend his head one more time off to his right, and I just shake it like that, and I thrust it. And sometimes, you can relax for me, you'll hear an audible release. You don't always need to hear an audible release, and sometimes you can actually feel the tympanic membrane and the three little bones inside of the ears move. So that's basically what I would do. Just to repeat, you grab a hold of the earlobe very gently, not too firm, have him tip his head off to the side. Sometimes I might have to do 2 or 3 thrusts. You may think about if there's a chronic infection, take their temperature, do a CBC with a differential. If it's really red and inflamed, pass. I think that would be just a really logical approach to this, but this works very successful. We've had a lot of improvement using these ear adjustments. Thank you so much.